Um, is everybody hearing me okay? Perfect. Well, thank you very much. I really appreciate being here. And I'm excited to talk to you about some of the work that we have going on around climate change and human health, especially here in Nebraska. I've been in Nebraska for about 4.5 years. I'm originally from Nebraska. I'm from Northeast Nebraska. I was born and raised, but I came back for this position at the University of Nebraska about 4.5 years ago. We've seen a lot of growth in working on issues related to climate and health, extreme weather and health, and I'll talk a little bit about that and talk a little bit about some of our work, talk about how we've developed some programs, and then also talk about how we can potentially move forward to continue to try to tackle some of these issues in the future as well. So just to start it off, so I'm the Director of Water, Climate, and Health at the Doherty Water for Food Global Institute. I'm also the Director of the Water, Climate, and Health Program at the University of Nebraska Medical Center. Those two institutions, those two programs kind of overlap quite a bit in what we do and what we engage with. And basically, in short, when I talk about the Water, Climate, and Health Program, this was funded by the Clarence Hubbard Foundation, which is a local foundation that supports different issues associated with environment, education, and also with diversity and inclusion issues as well. And this program was started in 2020. I'm the director. It brought together expertise to really try to push forward on some of these issues to dealing with water quality and water quantity in Nebraska and how that's impacting human health. So this is the main premise of the Water, Climate, and Health Program, and Water, Climate, and Health within DWFI is to build interdisciplinary collaboration across the University of Nebraska system and also across Nebraska as a whole to address our public health challenges associated with water and climate. And when we're doing this through research, education, policy development, and also training. And when we're talking about training, we're talking about students and how to get them engaged in some of these conversations and some of these projects. But also training for individuals across Nebraska as a whole. And so when we talk about the Water, Climate, and Health Program, we really have two major pillars that we're kind of building around, which is one, water quantity, and also water quality. Water quantity is where that climate piece really fits in, so that's when we're talking about flooding, droughts, either the abundance of water or the lack thereof. And each time that we see either a flood or a drought, there is a potential for human health outcomes. And I'm going to talk about that in a little bit. And then we also do a lot of work around water quality. This is looking at how changes in water quality potentially impact human health, especially here in Nebraska. And I think some of my colleagues have talked to this group before. I think Dr. Rogan just spoke to you guys a couple weeks ago, if I remember correctly, around some of the work that she's doing. And so we've grown quite a bit over the last 2.5 years. Whoops, didn't like that slide. All right, well, we'll just skip through that. But anyways, because I'm not going to fight with it. We're now up around over 20 faculty, staff, and students that are associated with the Water, Climate, and Health Program. We have a variety of different expertise, everything from statisticians, biostatisticians, to data science people, people with pure public health background, public health policy, with law degrees. We really have a broad spectrum of expertise that we have a part of our group. And one of the things that we're really trying to do is also engage with students as well. And so we're doing everything from working with PhD students that are doing research, public health students that are doing actual engagement, and how to better communicate and engage around some of these issues associated with public health issues associated with water and climate, to medical students. And we have a cohort of medical students for the last 2 years that have been working on some of these issues as well. And so when I talk about climate and health, we have a lot of experience to draw upon. You know, a lot of times, you know, I've been working in this area or this arena for over a decade. It's about 2 decades as far as looking at climate change. and a little over a decade looking at climate and how it impacts human health in particular. And a lot of times when we're talking about climate change and we're talking about how climate impacts human health, there's been a lot of momentum and a lot of growth over the last 10, 15 years in this realm, but we've understood these connections between climate and health for generations. We can go all the way back to Hippocrates, who is a lot of people think of Hippocrates in the context of, one of the foundations of modern medicine. And the Hippocratic Oath, for example, comes from Hippocrates. So he was a physician in ancient Greece. And one of the things that you can do is as you're looking through some of his notes because he took a lot of detailed notes back quite a while ago in ancient Greece, one of the things that he was able to notice was that changes in weather patterns were related back to outbreaks of certain diseases. And so even back then, he was able to understand that relationship between weather, climate, and human health. And then you move forward, and obviously there was a lot of work that happened between him and Dr. James Tilton, but I'll keep it in the United States to try to have that U.S. focus a little bit. Dr. James Tilton was a Surgeon General for the U.S. Army back in the early 1800s. And he directed all hospital surgeons, medical doctors, within the military to take measurements of precipitation and temperature. And the reason for that was they understood at that point that with changes in temperature and changes in precipitation, they were seeing troops, military troops, getting sick. And at that point, it was things like malaria, yellow fever, and some of these diseases. They didn't understand what was actually transmitting those diseases, which today we understand mosquitoes carry yellow fever and malaria, and that's able to transmit the disease. They didn't understand that, but they could understand that the change in temperature and change in precipitation was causing outbreaks of disease. It's also interesting because when we talk about climate change and understanding climate change, it's actually some of these military records of precipitation and temperature that we have starting back with Dr. James Tilton that has allowed us to better understand how our climate has been changing, especially here in the United States. Because we have very good historical records of climate change, or of climate in general, which then allows us to understand how our climate is changing. So what do we know? And there's a lot of other information that I can talk about as far as how we understand certain diseases are more linked to our climate and weather and environment around us. And I'll talk about that a little bit, but I won't go into too much detail. But what I really wanted to focus on is how climate is changing and how that is potentially impacting human health, especially here in the United States, and especially here in Nebraska. So we know our climate is changing. I'm sure every one of you is quite well aware of this. We've seen an increase in temperature over the last century, and especially with land and ocean observations. We know that that temperature change, as many of you have already seen multiple different times, is not equally distributed across all places. Some places the temperature is warming at a higher rate than others. This is especially higher latitude and higher elevation locations. And we're even seeing cooling in some locations. But when you look at it over the entire globe, majority of areas most areas are increasing in temperature. And not only are we seeing a change in temperature, we're seeing a change in precipitation. And we understand the physics that drives that. Here in Nebraska, in this part of the United States, we're actually seeing things get a little bit wetter. In the western part of the United States, things are getting a little bit drier over time. And we expect these changes to continue into the future. We expect that our temperatures will continue to rise and our precipitation patterns will continue to change. Here in Nebraska, some of the climate models, as they're projected out, expect our winters to get wetter and our summers to potentially get drier. Now that would obviously have impacts on a variety of different things, especially when we're talking about agriculture, but I can tell you a little bit about how that could potentially be related back to human health as well. So the hottest days of the year are expected to get warmer. So it's not just the changes in the mean or the median as we move forward. We expect changes within the extremes. And so the hottest days of the year are expected to get hotter, the wettest days wetter, and potentially longer dry spells as well. And some of those extremes we're already seeing. And I really try to emphasize this because I think these are the impacts that we understand the best. Our extremes are changing, and so heavier precipitation events, especially in certain parts of the United States, higher intensity, longer duration, tropical cyclones, hurricanes. Over the last, especially 30, 40 years, we've been able to identify patterns there. Sea level has risen, which we're not too worried about here in Nebraska. We're seeing an increase in the intensity and severity of winter storms. We're seeing intensity of droughts and heat waves, especially in the western part of the United States. Also, with that association, we're seeing longer wildfire seasons and more impactful wildfires as well. And so, that's over the last 50 to 100 years. We've seen these changes, especially here in the United States. We've seen these increases in extreme weather and climate-related events. And now, because of advancements in science and better understanding some of the physics that drives some of these systems and the complexity of some of these systems, we're actually able to say certain extreme weather events that are occurring today are more likely changing or being influenced by anthropogenic climate change. And so today, heat waves are likely more frequent and intense because of human-caused climate change. Coastal flooding, extreme precipitation events, winter storms, and even severe droughts. There is strong to very strong evidence that those events and the changes that we've seen over the last century are likely due to human-caused climate change. So that's the broad summary. Many of you have already heard a lot about this type of stuff and the changes in our environment and how that is occurring and the changes in our climate. Now, the second piece that I'm going to talk about is how that's actually related back to us. And that's where I've seen the conversations change over the last 20, 30 years when we talk about climate change. Historically, when we talked about climate change, a lot of times it was 50 to 100 years into the future. Or when we talked about climate change, sometimes we talked about the impacts in polar regions or various other things, and I know polar bears have definitely gotten a lot of attention. I care a lot about polar bears, but let's be honest, not everybody cares about polar bears. Not on a daily basis. And that's where the conversation has started to shift a little bit, is understanding how these changes in the environment around us are actually impacting us. Because I think for a long time we've kind of left that out of the equation, and now we're starting to understand, and we're starting to recalibrate and realize these changes in our climate, changes in our environment actually impact us. And we've, like I said, we've understood this going all the way back to ancient Greece, to the Surgeon General for the U.S. Army in the 1800s, and many people in between, that surprisingly our climate is impacting our health. And so there's been a number of different studies and comprehensive reports that have shown these relationships. The one that I always try to focus on, because it was one of the first real comprehensive studies that focused here in the United States, was back in 2016. It was released by the White House, but even though it was released by the White House, it brought together expertise across every federal agency, the Health and Human Services, CDC, EPA, Defense Department, NOAA, NASA. There were medical doctors, public health experts, physicists, climate scientists, all working on this report to understand how climate change is impacting human health. This was one of the first reports like this in the United States. It was one of the first reports like this in the world, but it was really focused on the U.S. This big comprehensive report, you can still see it. that came out in 2016. It was called The Impacts of Climate Change on Human Health in the United States, a comprehensive scientific assessment. It had numerous findings, numerous chapters, focusing on infectious disease and various other factors as well. But with all of this, there were a number of key findings that came from the report. One of the first things that was written in the report, one of the first findings that came out of the report was, up here, climate change is a significant threat to the health of the American people. And the reason that they could say that was when they look at all the ways that our climate has changed, whether it's changes in extreme weather events that we've already seen, and the projections that we expect in the future, to the rises in temperature, changes in precipitation events, there's really no place in the United States that isn't being impacted in some way by climate change now and also in the future. And so that's why that statement was easy to say. It has a significant threat to human health for all Americans. And so, yeah, every American is vulnerable to the health impacts associated with climate change. That was one of the other key statements that came out of there. And I'll talk about that in just a little bit. So I put this figure up here, and this is one of the figures that came from this report, and I really like this figure for a number of different reasons. Is it up at the top, that blue box up at the very top, we have climate drivers. And so this is the changes in our climate system. This is increases in temperature, changes in precipitation, more extreme weather events, sea level rise for places outside Nebraska. There are those things up here at the top that impacts the environment in some way. So that's the exposure pathway. So with these changes in climate, then we see things like more extreme heat events, poorer air quality, reduced water quality and quantity, more changes in infectious disease agents, and then also population displacement. Anytime any of these, which can happen from extreme weather and climate events, which anytime any of these happens, it can lead to human health outcomes, and a variety of different human health outcomes, and I'll talk about some of those in just a little bit. And so that's why I put this figure up here, because it kind of gives you that pathway of how climate, changes in climate, and just climate in general, can cause human health outcomes. But the other reason I put this up here is because of these gray boxes on the outside. And sometimes these are forgotten when we're talking about the impacts of climate change. So this is the social and behavioral context and also the environmental institutional context. When I say social and behavioral, in medicine we sometimes refer to that as the social determinants of health. And that is, when you go out into a community, that's the people in the community. That's that social and behavioral context. And so if you go to Omaha, or if you go to Lincoln, or if you go to some other place anywhere in the world, and you look around at the population that's in that location, you'll notice that there's changes and differences in age, gender, race, ethnicity, poverty, education, housing, discrimination, access to health care, and pre-existing health conditions within your population. Then, on the other side, you have the environmental institutional context. This is the environment itself that those people live in. And so this is land use change, this is ecosystem change, this is where is the geography of where they're living, what is the agriculture, all of these different things. What is the infrastructure itself that they're living in, these individuals are living in. And climate can impact those factors, but also those factors impact that pathway. And so if a flooding event or changes in our temperature happen in Omaha, Nebraska, or they happen in Phoenix, Arizona, or they happen somewhere else in the world, the health outcomes that occur are going to be different. Some of them are going to be the same, but some of them are going to be different because of those two gray boxes on the outside. And one of the things that I really tried to do is, it's kind of funny. Like, I said, when I first started working on climate change, health wasn't really thought of. Then, at some point, people started thinking more about health, and then the conversation seemed to kind of change a little bit. And people were like, well, it's like a freight train coming at you, and there's nothing you can do. And one of the things that I really try to emphasize now is how we prepare, like how climate change is coming at us, and some people are like, well, there's nothing we can do. It's just coming right at us. There's potential health impacts, and that's what we're going to face. And one of the things I really try to emphasize is how we prepare and how we respond influences the outcomes. And so if we understand our community, these social and behavioral contexts, environmental institutional contexts, we can help build support within those gray boxes, within those two areas, that can reduce human health impacts and prepare communities for the future generations as well. So that's where a lot of my work is focused. And so I said all populations are vulnerable to the health impacts associated with climate change because of the way everything around us is changing. But there are certain populations, especially here in the United States, that are more at risk than others when it comes to climate change. And this isn't a set in gold standard, but these are typically for the populations that are more at risk. Communities of color, older adults, low-income communities, and children. And this kind of goes back to those social determinants of health. There are certain things, whether it be discrimination, racism that maybe these communities face, a lack of access to care, education, poverty, underlying human health conditions, all these other factors that can potentially make these communities, or individuals in these communities, more at risk. And we still have a lot of work to do to better understand some of these impacts and how to better prepare some of these communities for the health impacts that they face with climatic and extreme weather events. So I could talk at length about a lot of different health impacts associated with climate change. You know, there's everything from vector-borne disease to extreme heat and extreme weather. I'm going to pick out, or I decided I was going to pick out just a handful to really try to isolate down and focus on. And mostly because that's some of the work that we're already doing here in Nebraska and trying to expand some of our work here in Nebraska around. Extreme heat is one of those areas. Like I said, we've been seeing an increase in extreme heat-related events, especially over the last 50 plus years. And that's especially in the western part of the United States. Various areas have differing relationships. That extreme heat is increase in temperatures, higher humidity, longer, more frequent heat waves. When these events occur, you can see things like human health outcomes such as heat stroke, dehydration, heat-related illness. At-risk populations are typically outdoor workers, student athletes, people living in cities, more urban areas, people without air conditioning, people suffering from certain chronic diseases, pregnant women, older adults, and younger children. And we know this because those are the ones that are most likely to go to the hospital across the United States when these types of extreme heat events occur. Actually, before I jump ahead, and I'm kind of opening this up a little bit. So when we talk about different climate and weather-related disasters and the impacts on human health, I'm just going to throw this out here because I think there's students in the audience, if I'm not mistaken. Any ideas on what climate and weather-related disasters likely kill more people in the United States? Boom, yeah. I know, I was kind of like jumping ahead or killing the punchline by throwing this up here. But yes, heat waves likely kill more people in the United States than any other climate or weather-related disaster. Any ideas why that is? And what is unique about heat waves compared to other climate and weather-related disasters, such as hurricanes and floods and things like that? Right. Yeah. And they occur everywhere, right? There's a heat wave that will happen. I promise you, there's going to be a heat wave. Well, I shouldn't promise, but high confidence, there is going to be a heat wave that hits Nebraska this summer. Maybe even multiple. There's going to be heat waves that hit Phoenix, New York, maybe even Seattle, or even down in the southeast as well. And that's part of it. You see extreme heat events everywhere. And you might see extreme heat events multiple times of the year. Flooding events, hurricanes, some of these other events, although they can be very impactful, they're usually isolated to one location. Where extreme heat can happen everywhere and in multiple times. And it's difficult to get out of the way of these events as well. Now, this is one of the studies I'm going to talk about that doesn't have a relationship with Nebraska, but I love this study, and so I put it up here. And it's my study, so it's easy to talk about. So we understand that our climate has changed, right? And when we look at climate change, kind of going back to it, we're able to see this change in temperature that has happened. This is looking at global temperatures over the last 50 to 100 years. And this is the Earth's temperature observations. And so we've seen this increase in the temperature. And we have these physics-based models. And we've understood how carbon dioxide and other greenhouse gases are related to the Earth's temperature. And we've understood this for hundreds of years as well. Arrhenius was one of the first chemists/physicists that really looked at that relationship between an increase in carbon dioxide in the atmosphere, and he did this around 1900 and was able to mathematically calculate that with an increase in carbon dioxide, we should see a progressive increase in temperature as well. And so building off of those physical mathematical equations that Arrhenius had, we're able to do much more complex math with much more complex modeling today and find those exact same relationships. And so when we look at our Earth's temperature, which is the solid line, which I don't know if you can see that very well, but the solid line is our average Earth's temperatures over the last 100 plus years, and we've been seeing, especially over the last 50 or so years, 50 to 100 years, been seeing an increase, a dramatic increase in temperature. And using these models, they can run the models, these climate-based models, and actually run it with changes in CO2 and carbon and other greenhouse gases and see how our temperatures are related back to that change in greenhouse gases versus running it without the change, just traditional forcings. And what we see is a difference between the two. And that's one of the ways that we can understand why, when I talk about extreme weather and climate-related events, we can actually say, these are more frequent and intense because of the changes in greenhouse gases that we've seen over the last 50 to 100 years. And so what we did was look at how extreme heat events, especially in North Carolina, have changed over the last 50 years, or changed because of that change in greenhouse gases over the last 50 years. And so we found, extreme heat events that occurred recently in North Carolina were more intense and more likely to occur because of anthropogenic climate change. Well, we had really good access to hospital admission data within North Carolina as well, and heat-related emergency room visits. And we were able to develop a relationship to understand how many people we predict to go to the hospital with certain temperatures. And then we ran those models based off of what we see today versus what we would see without anthropogenic climate change. And then we were able to estimate how many more people went to the hospital, to the emergency room with heat-related illness under current conditions versus conditions where we did not see this anthropogenic change. And what we found from 2011 to 2016, because of access to data, that we saw a roughly around 13.4 to 16.4% of emergency room visits in North Carolina were related to anthropogenic climate change, because our temperatures are warmer today than they were without that. And our heat waves are different today than without that. And you can also project that forward as well, and we actually found that that percentage over time would continue to increase as well. And so the reason I put this study up here is to illustrate, a lot of times when we talk about climate change, sometimes we're talking about it like, what's the impacts in the future? This study helped us identify that those impacts are already today. We can already identify that there is a potential impact on human health right now that we've already faced because of the changes in our climate system. So I put that one up there. But we're trying to continue work here in Nebraska to better understand how changes in temperature and temperature just by itself are impacting human health. One of the studies that we did, and this was through funding through NOAA, through NIHIS, the National Integrated Heat Health Information System, provided the funding for this, was to try to understand the urban heat island effect in Omaha, Douglas County, Nebraska. And if anybody's not familiar with this, this kind of illustrates it down here at the bottom. As you go into more urban central areas, into metropolitan areas, you see more concrete, you see more blacktop, you see more human development, less trees, less green space, and temperatures increase as you go in to some of these urban areas. And you can actually see up to 10 degrees Celsius increase in temperature, even I think higher than that in some places, as you go into the urban center. Well, one of the other factors that interplays in that is also when you're going to some of these locations, some of these areas are historically redlined. How, is anybody, just a raise of hands, has anybody ever heard of historical redlining? All right, most of you. If you haven't heard of this before, these were financial practices, policies that were put in place back in the early 1900s that basically they designated certain locations in cities and various areas. They made it more difficult for financial investment in those areas. That was one of the practices that took place. And a lot of times they did those, that what now we refer to as redlining, because of it was communities that were a higher percentage of people of color or ethnicity. And because of those practices, we can see the impacts today within those communities because of the lack of that investment. Over time, still has a carryover. Even though that those practices are no longer in place, we can still see the impacts today. And Omaha has historical redlining. There were certain areas of Omaha, especially North and South Omaha, that were historically redlined, and some of these practices were put in place. And we know that extreme heat has impacts in Omaha. So this article here was from one of the hospitals. They showed 30 hospitalizations at CHI in Omaha associated with extreme heat, at one extreme heat event that happened, I think it was either in 2019 or 2018. So that just to illustrate that we do see health impacts here in Nebraska associated with extreme heat. And the other factor that we have over here is because of those social determinants of health, because of those gray boxes that I was talking about, certain populations are more at risk to extreme heat exposure, but also health outcomes associated with extreme heat. And as you can see, some of those areas, the darker kind of bluish color, is where populations are more at risk, which is North Omaha and a little bit of South Omaha, which are some of those areas that were historically redlined in the Omaha area. And so not only are temperatures potentially warmer as you go to some of these urban centers, but also the populations that live in some of those locations are potentially more at risk to extreme heat exposure than the surrounding populations. And that's why these studies are kind of important. And so this was one of the things that we did, working with funding that came from NOAA this last summer. We were part of an urban heat island mapping campaign. We were one of the cities that was selected. There were a handful of cities selected across the United States. And what happened was we got a bunch of citizen volunteers. They put instrumentation on their cars. They drove throughout the city for one particular day to try to map out how temperatures are different in different neighborhoods in Omaha. We're now in the process of taking that data, processing it, and trying to understand what does it actually mean for the communities in Omaha, and how do we use that information to better prepare our communities for future changes in temperatures that we will experience as well. And I'm just going to put this one in here. I put this one in here. This was from one of the studies that we published. So what we show here is a lot of times we focus on urban areas. But sometimes rural areas are not always focused on when we talk about climate change and when we talk about climate and the impacts of climate on human health. And so this study was basically to try to identify how heat vulnerability changes as you go from a more metropolitan area to a more rural area. And one of the things that we found in this was what makes a population or populations more at risk of extreme heat in an urban area is different to what makes populations more at risk in rural areas. And sometimes we think of those in kind of a homogeneous way, but the purpose of this study was to show that there are issues and differences between those populations. So, extreme heat, it's one of the areas we're working on. Extreme weather is the other one. Like I said before, we've seen an increase in the frequency, severity of heavy downpours in certain parts of the United States, floods, droughts, and major storms. This can lead to injury, illness, displacement, and death. Populations at risk, pretty much anybody in the pathway of some of these events are somewhat at risk, but certain populations are more at risk than others. These are especially people who lack access to evacuation routes, especially if the more severe storms and events, people that cannot use elevators to evacuate, older adults, low income, people with disabilities, and then, again, anybody that has difficulty evacuating from the area that's being impacted. And so I always put this one up here because I think this really highlights or does a good job of really emphasizing the impacts that these types of disasters have. And so these are climate and weather-related disasters. The cost of, or the number of billion-dollar climate and weather-related disasters across the United States for about the last 40 or so years. And this comes out of NOAA. They process this every year, try to understand what's going on in the U.S. And one of the things that you can see over time is that we're seeing more of these billion-dollar climate and weather-related disasters here in the United States. Being somebody that works in public health, I always like to point out this one right here, which is 2020. We think of 2020 a lot now in the context of COVID. But 2020 was a record-setting year as well when we're talking about climate and weather-related disasters, billion-dollar disasters here in the United States. There were 22 of these types of disasters in the U.S. Each one had significant financial impacts, displaced populations. And so when we talk about climate change, sometimes we're like, well, we can talk about it later, because right now we have to deal with COVID. Or we can talk about this later because we have this other issue. But the problem is that these issues don't wait for each other. They have a tendency of happening in a compound way, and when they happen in a compound way, the impacts can be even more significant or more impactful. And we're definitely familiar with extreme weather and climate-related disasters, especially these billion-dollar disasters in the United States. In particular, in 2019, this was after about a year of me being here in a faculty position, We had very significant flooding that impacted this part of the United States. Nebraska was kind of at the epicenter of it. We actually did a report for this, talking about the impacts for Lancet, which is a medical journal out of the UK. They have a yearly report talking about climate change and the impacts of climate change on human health. I've been one of the contributors to that report for the last 5 years, 4 or 5 years. So, I'm sure many of you are familiar with the Missouri River and North Central flooding that happened in March of 2019, or started in March of 2019. Well, the conditions leading up to that started way before. It led to at least $10.8 billion of economic loss for this region, at least. It was the costliest inland flooding event in U.S. history. There were at least 3 deaths that occurred. We still haven't got a good hold of the total health impacts associated with this event. Hundreds of people were displaced. Like I said, it was the costliest inland flooding event in U.S. history, but it also had impacts on healthcare. Both with just impacts at the time of the flooding event, which there were at least 2 hospitals that sustained damage. There were a dozen long-term health care facilities that were evacuated. These are nursing homes. And that was just in Nebraska alone. And as you know, the impacts stretched throughout the Midwestern region. Those were the immediate impacts. But what a lot of times is lost with these types of disasters, the long-term impacts that these types of events have. And so lack of access to care issues, flooded roads, damaged infrastructure, damage to roads. What was a 1, 2, or 3 hour drive to the hospital, because we're pretty spread out state, all of a sudden became a 5, 6, or even 10 hour drive. And when you're talking about things like going to dialysis if you have diabetes, or if you're talking about an emergency that happens, those hours matter, both for the individual, just as far as stress, but also for reducing the potential health impacts as well. I should also say the conditions that led up to that event, there's been studies that have come out of NOAA and other places as well that actually show that that event, the conditions that led up to that event, people have related that, or researchers have related that back to changes in our climate system that we've seen over the last 50 to 100 years because of anthropogenic climate change. So the other piece that I work on is how drought impacts human health. The University of Nebraska, Lincoln, is one of the premier places, if you don't know this, I think Mark's in the back, and is one of the premier places for researching and understanding drought in the world. And so that's actually one of the things that attracted me to come here. And one of the reasons I wanted to come here is to work with Dr. Sabota and his team around some of these issues, because this is something I've been working on since I was at the Centers for Disease Control and Prevention. And when we were working on that 2016 assessment that came out of the White House, one of the things that became very apparent to me was a lack of work and research on how drought is impacting human health, especially here in the United States. Internationally, over the last century, drought internationally has likely led to more deaths than any other climate or weather-related event. But here in the United States, we really don't look at drought that way. The conversation is starting to change, but we really haven't identified that. But drought is very impactful. It is one of the costliest weather or climate-related events that we face here in the United States. And we've been able to show that there is a potential relationship when we're looking at billion-dollar disasters. Droughts, I believe, are number 2 in the number of total deaths, which is due to the relationship it has with heat and not all the other factors that it potentially impacts. But droughts are a little bit different from other climate or weather-related disasters. Droughts are slow evolving. The impacts of drought are not typically immediate. They require multiple steps before you can see health outcomes. And health surveillance isn't designed to connect drought to human health. And so there's still some complexity on looking at some of these relationships. But the way I look at drought is the way I look at climate change. Drought is a threat multiplier. Droughts can lead to more intense heat waves, wildfires, reduction of water quality and quantity. It can reduce air quality, and it can also change things like vector habitat. And we're starting to understand some of these relationships. There was a publication that came out from some colleagues from Yale, one of them's now at the University of Minnesota, that showed an increase in hospitalizations and mortality of older adults in the western part of the United States. We recently published an article last year that showed an increase in mortality in Nebraska with white females and white males between the ages of 45 and 65 years of age. And that's especially in rural populations. There's also been work showing changes in stress, especially in rural and agricultural populations. We published an article a couple years ago that showed that drought. So there was a survey that went out throughout the Midwestern part of the United States. This was an occupational survey that was primarily focused on farmers. One of the questions that was in that survey was around self-reported stress. And we found, based off our analysis, that during a major drought event, the 2012 drought event that occurred, that farmers were 4 times more likely to report that they were stressed during that drought event than if they were experiencing pain in some part of their body. And this is unpublished in some work that we were looking at mortality rates across the United States and looking at respiratory-related deaths in the United States. And we found that there's an increase in respiratory-related mortality associated with drought events, especially all these red states up here in the Midwestern part of the United States over the last 20 or so years. And so there's still a lot to understand on how drought is impacting human health. These are just a couple of pathways, but there's other pathways as well. Changes in water, changes in some of these other vectors and things that we were talking about. Recently, a publication came out that talked about how there were elevated levels of naturally occurring arsenic in private domestic wells across the United States during drought events. And it's estimated that 4.1 million people in the lower 48 are potentially exposed to higher than recommended arsenic levels during drought events because of this. So, I'm going to try to wrap it up. I apologize. I could talk about this stuff for hours. But the next step is, how do we actually do something about it? So we've talked about some of those relationships, but the next step is actually making sure that we have action on the ground. With drought in particular, like this is one area that I have focused on, is better communication, especially of our public health officials. How do we make sure that people on the ground understand these health impacts and are able to educate the populations that they work with? At CDC, we helped work on things like websites, flyers. This happened actually before I was at CDC, but guidance documents for public health officials, the second one that I've worked with. And then we've also hosted some drought and health workshops to try to understand how drought is impacting human health and how communities, public health officials across the country are engaging in these issues. And so we've hosted a number of workshops across the United States, gathering information, trying to better understand, especially from a public health perspective, what's actually going on. And one of the premises of this was to create a strategy document so that NIDIS, National Integrated Drought Information System, but also public health officials and emergency managers can better understand and respond to drought events. And so that's some examples, but there's still much more that can occur, especially in that public health arena. We can better educate, create better early warning systems for public health officials. We can do better research around some of this stuff, and then we can also help contribute to the public dialogue, especially in the context of public health, so that we're communicating these health impacts. There's still a lot of work that needs to be done in the realm of public health and how to better engage with some of these issues. Currently in the United States, we spend somewhere around 1.5 to 3% of all of our healthcare spend. When we look at how much we spend In the United States, on health in general, public health, which is prevention, is only about 1.5 to 3%. So we spend a very small fraction of that on preventing illness and disease, and even a much smaller percentage of that when we're talking about climate change. So there's still a lot of opportunity in trying to figure out how to better engage climate change in some of these conversations, especially around public health. So to wrap it up, climate change is a significant threat to the health of the American people and to everyone. Some populations are vulnerable, all are potentially at risk, or some are more vulnerable than others, all are at risk. Costs are increasing. There's a lot for us to understand. There's a lot of work that still needs to be done. And by combining our expertise and addressing these issues early, we can reduce health impacts in the future. And with that, a lack of preparedness, planning, and understanding can increase the severity of any disaster, including disasters associated with climate change. So if you have any questions, I'd be happy to address those. If you're interested in our program, we have a website. Feel free to go take a look at it. We also have a Twitter page that just came live last week, or last month. And with that, I'm happy to take any questions or comments that you have, and look forward to the discussion.
All right, who's got a question for Dr. Bell?
Thanks, Jesse, for the presentation. The question I have is linked to the last slide of the uncompleted work or unpublished work that you mentioned, and is linked to compound events. So have you explored, or what are your thoughts about the compounding of, for example, respiratory diseases, air quality, and then on top of that, drought, heat wave. And if you can continue adding things, might be access to medical attention, health resources, Medicare, Medicaid, or the possibility to access to a hospital. How do we build upon the complexity of these communities and improve our abilities either to diagnose or predict what may happen, as you pointed out, increase the preparedness?
Yeah, just doing health studies in the first place is incredibly complex and difficult. Access to data is always one of our big limiting factors with any of this. A lot of our studies that we've done is looking at mortality. Mortality isn't the best data set just in general to look at some of these health impacts. With the flooding that happened in 2019, we say 3 reported deaths associated with. But one, I don't think that captures the number well, and it doesn't capture the hospitalization. And, with COVID-19, we've kind of understood the complexity of our healthcare system, and especially with surge in healthcare. And that's why when going back to extreme heat event that happened a few years ago where CHI saw 30 additional hospitalizations associated with extreme heat, at the time when I even saw that, I was like, oh, 30 extra, But now after seeing COVID and realizing 30 extra is a pretty major thing, especially when you're talking about staffing and being able to address and deal with some of these issues. But so with that, the more access to data that we can have, especially when we're talking about morbidity, that's where we can make some really good improvements on understanding and reducing health impacts in the future. The other part of it is the compounding. I am very interested in that. Because right now, and I didn't emphasize this very clearly, but right now, a lot of the stuff that we're seeing is drought, increase in respiratory-related deaths. But that does not get at what are those factors. Is it an increase, because a potential increase in suicide-related deaths, which we have seen relationships with drought and that. Heat-related deaths. There's respiratory, which we were talking about. But what are those intermediate factors? Is it dust storms? Is it reduction in lung capacity. Like there's so many other factors that we need to do, and that's where we need to continue to improve our research and improve our engagement, but also understanding which populations are most at risk so that we can provide better education and outreach to those populations. So say a drought happens, how do we potentially reduce the impacts or prepare those communities for those impacts that they're potentially facing as well? I don't know if I addressed all of your question, but Thanks.
I'm going to take one online, and then I'll get back to the one, because we've got some online, some here. First question online is, it is easy to become pessimistic about climate change. Which vectors of change do you see that keep you optimistic?
Yeah, that's a good question. And, you know, I think, one, we're seeing more investment. And an investment to try to improve the strength of communities to address some of these issues. You know, the infrastructure bill that recently got passed, there's an opportunity to take advantage of that bill to make sure that we have more resilient communities. And, you know, pretty much, and I'd be happy to, if anybody has an argument around this, but pretty much we understand that we're in a changed climate and the climate is going to continue to change. Where I'm most excited is we can build resilience within our communities. We have an opportunity to go out there and actually do something that can reduce health impacts. And that's where these conversations, where we're at least starting to address some of these issues, like we know that certain communities are more at risk. We know certain populations are more at risk. If we can better identify those communities, those populations, there's things that we can do to strengthen those communities, strengthen those populations, that reduce human health impacts in the future. And there's nothing stopping us from doing that. We know the answers to those questions. The only thing that's stopping us from doing that is actually doing the work. And so collectively, we have the ability, we have the work, the knowing, the knowledge, and we just have to do the initial work. And that's where I'm so excited. And that's where I'm excited about the work that we're doing, is because that helps us get that first stage in trying to build resilience, to try to reduce impacts. And that's where I think we have an opportunity to really engage communities around a lot of this stuff as well.
Thank you for a very exciting and stimulating talk. 2 questions. As I thought about the study that I didn't see a citation, but your North Carolina study, I'd love to read it. I guess I'm wondering, my understanding is that the greatest threat to the increase in heat to various parts of the world and populations is the concomitant increase in humidity. And I don't know if you measured that. I mean, I don't know which measure you're going to use, I mean, meteorologically or climatologically, but my impression has been that's the biggest threat. And my second question is, what do we do about the fact that one of the ways we know to combat climate change is to move towards renewable energy? But as we do that, I'm not quoting our recent governor, who was particularly pessimistic here, but as we do that, we're not as able to deliver some of the air conditioning that we need to have throughout the world to handle all the increased heat waves. That will increase resilience. So how do we handle the incredible increase in power with not just one hot day during the summer, but 50 or whatever, and we have to budget that as we buy energy. I mean, I know there's the hottest day, as our utilities buy energy. But anyway, so 2 questions. Sorry, they're so long.
So, you know, the increase in humidity for sure, and that's one factor within it. We're also seeing a higher rate of the minimum temperatures. When we're talking about human health impacts, minimum temperatures, it's good to have that reprieve at some point, and that's why air conditioning and a cool house at night, and why humidity is important, because that minimum temperature exposure. Like if your minimum temperatures are higher, which we're seeing a more sharp rate in increase in minimum temperature than max, that's where some people relate that back to human health outcomes. The other piece of it, and there was a really nice study that was done from CDC, from some of my colleagues there, that showed what causes people to go to the hospital with heat exposure varies by what you're used to. We're pretty good at when our bodies can adapt to the environment that we're in, but it takes a little while for our bodies to adapt. As physiological changes, so when you first get exposed to that first heat wave in the summer, it's going to hit you a lot harder than the second or third one. And partially because of that, your body is making physiological changes to adjust to the temperatures that you're at. And the study that was done in CDC showed when they basically took a transect across the United States, and they looked at what were the temperature exposures and the differences in temperature exposure from places like Phoenix, Arizona, all the way up to like Boston. And what they showed was, as you can imagine, what was sending people to the hospital in Phoenix, Arizona, the temperatures were closer to 100 degrees. Boston, it was like 80-some degrees. And that's where you start to see those increases. And that's why changes in our temperature, changes in what we're used to is so important. When you look at northern Europe, when heat waves, as the heat waves have been more impactful there, why the impacts have been so significant. It's because in northern Europe, they don't have air conditioning. They're used to more mild temperatures. And all of a sudden, when you see these sharp heat waves, there is potential for human health impacts associated with that. But it kind of goes back to what you're talking about, which is all of a sudden where northern Europe or Seattle or places where they weren't traditionally, they didn't have air conditioning, now all of a sudden they need to install air conditioning because it becomes an issue to protect human health. And that's the complexity of it. And I wish I had a good answer for that. But that's what we're going to see in the future as well. As some of these places become less hospitable to live, you're going to see changes that are necessary to keep people alive. And unfortunately, what happens is, as things and costs continue to increase, populations and people that can afford it, it becomes an equity issue. It becomes, all of a sudden, those that can do, which reduces your health impact, but those that can't, don't, and that means that they're more exposed. And yeah, I don't want to bore you with a bunch of stories around that, but that is one of the big issues that we have. And with more renewable energy, there is a possibility of reducing some of that impact in the future as well. But there is also an added burden and added cost that's associated with this.
Thanks, Dr. Bell, for your presentation. So earlier when you were talking about extreme heat, you mentioned how we often think of rural and urban heat exposure as homogeneous. I was wondering if you could go into more detail on the difference of how rural people are impacted, or like in what ways they're impacted differently.
Yeah, that's a good question. Well, and I'm trying to remember all the different, there's different levels of exposure. There's certain populations that are more at risk in rural areas. A lot of times you have more outdoor workers. You have also less vegetative cover. Also, one of the things that a lot of times that we miss when we're talking about various populations and differences in populations, rural populations, and this surprises people sometimes, rural populations are more likely to be on Medicare or Medicaid. They're more likely to have access to care issues as well. So, like I was talking about before, what is, in Omaha, for example, you can basically throw a stone and hit a hospital. When you're in a place like where I'm from, in Bloomfield, Nebraska, 30 minutes, an hour, whatever it potentially may be to get to a hospital. There's less specialty care in rural areas. Rural areas are more likely to be on government assistance than urban areas. There's a number of different factors that are interplaying in rural areas that people sometimes overlook or don't know about. And so those are some of the factors as well. Just general demographics of the population. And it's older population too. Rural areas and especially small communities in rural Nebraska, for example, are much older than a lot of times in urban areas, just by percentage-wise.
All right, we got a couple more questions online. While your research shows that there are sectors of society that are more vulnerable than others, it also seems clear that those are also sectors that are underrepresented in the political arena. How can we build connections between the science and research and the political audiences to help deliver the resources to protect those vulnerable populations?
Ooh, that's a good question. Well, you know, one of the big things that we can do is providing more representation. A lot of these issues, as they were saying, is, you know, there's individuals looking like me talking about these types of issues. We need more diverse representation of people both in positions of power, but also that are working on and addressing these issues at the ground level, and making sure that we're providing resources to help better prepare and address these issues in those communities as well. And then the other big factor is, I would say, making sure that we actually help educate and inform about some of these underserved communities that don't have the resources available, and making sure that we, as collectively, as researchers, as policymakers, as people that are working on the ground, are actively thinking about these communities and making sure that we're providing both representation within our work, but also communicating our results to these communities as well, so that they can be advocates for themselves and understand some of the threats that they face. You know, that is such a complex issue, and I could give like an entire another presentation to try to address it, but that's my short summary.
All right, well, we're already over time. There's a few more questions online, but I'll see if maybe Dr. Bell can respond directly to those online. Let's give him one more round of applause.